Two real numbers landed today, a new treatment center and 65 patients, and the do not travel sign still hasn't budged. So which one tells you where things stand? If you're just joining us, the DRC Bundibugyo outbreak has been about delayed recognition, uneven lab capacity, and contact tracing under strain. Before today, authorities were reporting 956 confirmed cases and 247 deaths, with Ituri carrying most of those confirmed cases, and responders were still calling it an outbreak in its upward phase. That's the baseline for this care capacity update.
This is Ebola Watch. Today, a new WHO treatment center, MSF's first hard patient count, and a Level 4 advisory that still won't move. Let's start with what the center actually is and where it sits.
If DRC Bundibugyo Ebola outbreak matters to you, hit follow. We'll be back on it soon.
This one comes via the World Health Organization. A new update on the Bundibugyo outbreak. WHO is now pointing to a new modern treatment center in the DRC as part of the care response.
Okay, so translate modern treatment center into plain geography for me, Sarah. What district is this in, and how far is it from the cases?
That's the detail I want too. WHO's photo story celebrates the infrastructure, isolation capacity, dignified care, but it doesn't really say where it sits relative to the case clusters in North Kivu and the supply pressure flagged around Bunia.
Right, because if the center's 2 provinces from the patients, it's a photo op. If it's an ambulance ride away, it changes the response.
And both things can be true. Capacity arriving is genuinely good news. I just want to know whether it closes a gap or just photographs well next to one. Here's Benjamin Haynes at Centers for Disease Control and Prevention, CDC.
Dr. Satish Pillai, who is leading CDC's Ebola response, will talk through the 2 MMWRs we just released about DRC and our risk assessment for the United States. Then, Dr. Jason Asher, the head of our Center for Forecasting and Outbreak Analytics, will talk about the modeling MMWR.
The CDC put 2 MMWRs on the table here, plus a U.S. risk assessment. Dr. Pillai on the response side, Dr. Asher on the modeling side. So this is CDC showing its work, not just giving us a headline number.
2 MMWRs and a forecast, okay? But this transcript is dated June 5th, and the State Department's Do Not Travel notice hasn't budged. So what did the modeling actually say, if anything, that should change how I read a June or July booking?
Careful there. A modeling MMWR is a U.S. risk estimate, not a travel ruling. Asher's center is forecasting where the outbreak may go. The Level 4 advisory is state's call. 2 agencies, 2 different questions.
Right, but the listener doesn't carry 2 passports for 2 agencies. If CDC's risk assessment to the U.S. is low and state still says, do not travel, somebody should say out loud that those can both be true at once.
Here's Doctors Without Borders.
We are at a crucial point in the epidemic, said Bérangère Guy, MSF's emergency coordinator in Beni. Yes, the number of patients in the treatment center has reduced significantly, but new cases from a number of different chains of transmission have emerged in recent days. We must continue to work with the community to build trust and ensure that everyone presenting with symptoms of the Ebola is isolated and tested quickly.
Okay, here's the first hard number that means something to me. MSF treated 65 people in their first month, and that's over 80% of confirmed patients hospitalized across the region's treatment centers.
And notice the wording, confirmed patients. 80% of confirmed cases in MSF beds tells you who's carrying the clinical load. It doesn't tell you who's still out there unflagged.
That's exactly my worry. If 45% of contacts weren't being traced, are those 65 the people surveillance found, or the ones who walked in sick on their own? Because those are very different stories.
The encouraging line in that same report, 29 of those mangina patients recovered and went home. With a virus this lethal, discharges like that mean the system is working where it can reach people. Here's TravelGov.
Democratic Republic of the Congo, DRC. The Department of State updated the Democratic Republic of the Congo, DRC, travel advisory, which remains level 4 and continues to advise U.S. citizens do not travel to the DRC due to the Ebola outbreak. On May 22nd, the U.S. Centers for Disease Control and Prevention, CDC, issued an updated level 3, reconsider non-essential travel health notice for Ebola for the DRC.
So here's the thing. A listener with a June or July booking actually needs. State just reconfirmed level 4. Do not travel. Same as a war zone. But that restamp is dated May 27, and it points back to a CDC notice from May 22nd.
Right, and notice the two agencies aren't even at the same number. State says level 4, avoid entirely. CDC sits at level 3, reconsider non-essential travel. That's a full step apart.
And nobody's reconciling it. So if I'm holding a ticket, which agency am I supposed to listen to?
Both, honestly. They're answering different questions. State is telling you not to go. CDC is telling returning travelers from DRC, Uganda, and South Sudan what to do on the way back. That CDC notice spans 3 countries, Daniel. That's how wide the risk zone has stretched.
Which is the part that should worry the parent of a Peace Corps volunteer more than the level number. It's not just Congo on that list anymore.
And the honest read today is nothing has really moved on the advisory side. May 22, May 27, those are old decisions being republished, not a new escalation. If your itinerary was risky a month ago, it's risky on the same terms now.
If you rely on Ebola Watch for clear updates on urgent global risks, try Iran War Daily, our daily foreign affairs briefing on the U.S.-Israel-Iran war, from strikes and ceasefire talks to oil markets and spillover. Find it wherever you listen to podcasts. If you want to sit with any of today's stories a little longer, we've put the links to each source in the show notes. They're there whenever you want to dig in. That's Ebola Watch for today. This is a Lantern Podcast.